Uh, Good afternoon, everybody. Hopefully everybody had a nice weekend. We'll get into some data, touch on some topics, and then take some questions. Fortunately, we did not lose anyone over the last 24 hours in our community. Grim reminder of the virus is we've lost 192 of our neighbors in this process since it came to us on March 16th. But good news, over the last 24 hours, we did not lose anyone. Looking at testing and cases, since yesterday in Onondaga County, we've received over 2,300 tests. Again, our mandate for the region is 775 per day. Our region reported over 7,000 tests over the weekend, so a really busy weekend related to testing, which is important so we can continue to find asymptomatic carriers of the virus. And so that was a big weekend for testing. Testing has been obviously well reported nationally. Labs are backed up. We're making adjustments and bringing on new labs to help alleviate this moment in time. This is a moment in time issue related to that. But we still encourage people to get tested. And we'll get into certain demographics that certainly we want people getting tested. Even if the turn times aren't as quick as they once were, we still need to have people tested. Reminder, Syracuse Community Health Center, 9 to 5 during the week. Testing is now widely available at physician offices, urgent care sites as well. Certainly there's testing being done on nursing home employees and assisted living facilities on a weekly basis. If you're having a procedure done, you're getting a test as well. A negative test is necessary for you to be able to get your procedure. So there's lots of various testing going on in the community, but we still need people to get testing. The turn times are going to get better. More labs. The labs that are busy, our national labs, are building on capacity, but we need folks getting tested. Hospitalization still at 43, same as yesterday. Out of the 43, 26 individuals are from the memory care facility that we experienced an outbreak with roughly 3 to 4 weeks ago. Gives you an idea about how long it takes once folks who are coming from either an assisted living facility or a nursing home get into the hospital. They need to test negative to get out. Right now we have 17 folks who are waiting to return home, waiting for that negative test. So essentially we're around 26 individuals in the hospital that need care. Again, that number is on the lower end of where we've been with this virus, so we're happy with that. We have 7 individuals who are in critical condition. That's up 1 from yesterday. Another trend is, we have positive cases in senior-related facilities. 3-4 weeks later, we see ICU numbers trickle up a little bit. That's what's happened here. These are our residents that we can really least afford to get the virus. It impacts them greatly. So please keep these 7 individuals in your thoughts and your prayers. We need them to get well. Looking at who's in the hospital right now, 33 Caucasian, 3 African American, 1 of another race, 6 individuals that have not shared their demographic information with us. When we look at today's positives, since March 16th, we've now had 3,169 individuals contract the COVID-19 virus. That's up 11 since yesterday. So 11 new cases. Certainly, that's good news. 3 of the 11 are related to household contacts. 2 of the 11 were already in a quarantine. So when you look at the number of cases we had to contact trace, that's 9. 2 are new cases with senior living facilities. 3 community spread. 1 of them we know the transmission, 2 are unknown. And we have 3 travel related, 2 from the state of Florida, 1 from the state of Georgia. We currently have 320 active cases. That's down 6 from yesterday. We've had 2,662 people recover. That is up 17 from yesterday. We've had 1,853 females, 1,314 males, 225 cases under the age of 19, most of those being 17, 18, and 19-year-olds. 581 in their 20s, 436 in their 30s, 381 in their 40s, 474 in their 50s, 379 in their 60s, 284 in their 70s, 253 in their 80s, and 156 cases in their 90s. Our 7-day infection ratio for Onondaga County is 1.3%. That's an average. Why is that important? That number is going to be looked at when you look at starting school, 5%. The regional rate is actually lower than 1.3%, closer to 1%. So very good infection rate for the county and the region. Since Thursday, since we talked, we've had 66 new cases. 39% of these cases are under 30 years of age. Specifically 15 to 29 years of age. This is where we're seeing a lot of our new cases. These are demographics where people are socializing. We get it. I was there not too long ago, actually a while ago now, but a lot of social behavior, different friends, different groups of friends. We really need people in these demographics to get tested. We understand you're feeling well, you think you have an allergies. There's a high likelihood if you have allergies or think you have allergies that may be COVID. So we're still encouraging parents to please get your 15, 16, and 17-year-olds tested. If you're 18 through 30, we're encouraging you to get a test as well, especially if you've had increased social activity over a period of time. But I did want to show everybody what this looks like. So, as you can see with this, it just takes one case at one event, and then you have contacts that go to another event, and then you have other contacts that go to another, and then you have a cluster. And this is an example of what has happened in our community 4 or 5 different times. If we did not have these clusters, our data would be really incredible, even though it looks like we've moved past that week going into the 4th of July activity where we saw small little spikes. Last week our cases, our weekly average was lower, and certainly we're starting off this week on the right path. But this is a reminder that the virus is here. One unforced error. If you're at a party and you're within 6 feet of each other and you're not wearing a mask, even though it might not be the cool thing to do, can lead to this. And this is real. This isn't just us pulling this off the internet. We don't got the exact names of the events on here, but this happened. So please wear a mask, be diligent with physical distancing so we can move forward and we can get business reopened. Control room call today really pushed for business to reopen. I spoke to various gym owners today. They have an alliance statewide. They put forward some pretty compelling guidance on how they can operate and open safely. We agree. We need to get these businesses open. The infection rate is very low. It seems to be now's the time to do this, so we're encouraging our state partners to really work with us on this. Really, we know the virus the infection rate around 1%. It's hard to imagine that we're going to get much better than where we are. So certainly we're encouraging these businesses who are on the sidelines to our state partners, let's get them going. Let's get them back to work. And we'll continue to do that. And obviously a couple important weeks related to how things are going to shape up for state and local governments. And certainly we need help. We didn't ask the federal government or any government to solve our problem. We've asked them to help us solve a problem. We were delivered a mandate, and our economy was delivered a mandate in the months of March and April to May 1st. You needed to be shut down. And that was something that the state government said we needed to do. The federal government agreed. We at the local government complied. And we agreed certainly for many of those decisions. But during that period of time, we lost a lot of revenue. And that was something that everybody said we needed to do to flatten the curve and then eventually bend the curve. We did it. Now we have a large hole. We've made up that hole, at least half of that hole by ourselves. We're not asking for a handout. We're asking for our partners in the federal government to help us with the revenue shortfalls and the increased costs to the pandemic. We've had success here in New York. We put forward a blueprint that other communities can now learn from, and hopefully they are throughout this country, and when they're seeing very difficult times now, but we still have to live with the ramifications of this virus on our economy, and we need help. And no more waiting around. I don't appreciate our workforce being used as a bargaining chip in negotiations with the Senate and the House. It looks like that's what's happening right now, and I don't appreciate it. I really don't. We need help. Everybody said we're going to help state and local governments in the past. Now's the time. So saying that, we'll take questions.
Last week we were talking about the dollar menu, chips, and all that. This week, the governor coming out and saying threatening bars could be shut down and restaurants because they're not complying. What do you have to say to that? I mean, he's not shutting them down yet, but he's definitely threatening that. Well,
if you saw the footage that I think the governor was looking at in Astoria, down in Queens, just ridiculous. I mean, so I think remember, in New York City, those weren't indoor restaurants causing that problem. I don't think that problem was just restaurants. That was mayhem. There was no enforcement of anything, right? So I know that the state looked at downstate areas. I know we haven't had those problems in our community. We had one outfit that got excited the first week they were open, and some of the patrons were excited and dancing and things like that. We worked with them. We warned them. We fined them. We fined them again. They closed down for a period of time. But we haven't had that issue. We had sheriff deputies patrolling waterways, making sure that there wasn't large gatherings on the water. So we're patrolling by sea and by land to make sure this doesn't happen. And so I get the issue. We don't have that problem right now, and we won't have that problem.
Last night you tweeted about Mitch McConnell's reported exclusion of state and local funding, even after Senator Schumer last week seemed very confident that it would be included. You called it a joke, and I'm looking for you to reiterate why you think excluding that is a joke.
It's an absolute joke. It's a dereliction of duty. I understand this process, okay? In my own previous world, I was the chairman of the legislature. So I was in charge of that branch of government. Leader McConnell is the head of the Senate. Bigger than the legislature, but same premise. When you are the boss of a legislative body, you do not just represent a district or a state. He essentially is a national leader. And we have a national crisis. And so he needs to do his job and recognize that in previous stimuluses, they said, we'll get to local governments. We want to see how bad this is going to be on state and local governments before we commit to a process or a number. Okay, we've gone through all this. It is bad. We need help. You do not, and there's elections going on. I don't even understand this. He has states that have senators up for election that are a little bit bigger than Onondaga County. I don't know how he thinks those senators can go look in Montana in a competitive election seat and go look. I think there's 700,000 people in Montana. It's a great state. I went there. I don't know how he thinks that his incumbent senator, who's in a tough race, can go to his local governments and say, we're not going to help you when they have increasing cases, when their economy is starting to have to get shut down, their revenues are going to be lost. So it's mind-boggling to me on many, many fronts. I think we're being used as a bargaining chip. It's not Ryan McMahon being used as a bargaining chip. It is my workforce. This is a mid-year budget problem. I have people who are working very, very hard to fight this pandemic and to put ourselves in a position for success so we can get our economy open, so we can contribute with revenues, not just sales tax revenues, but income tax revenues, which help the federal government. And they're still just in denial that state and local governments need help, or we're just being used as a bargaining chip in this process. And like I said before, Andrew, we are not saying we have a $100 million hole, give us $100 million. We could say that. That could be our position. But we have held back hiring 300 positions, almost 10% of our workforce. That I could have went and filled all those spots and given those people, they would have had a lot of things to do, and would be 300 people who are paying into the economy. But I didn't do that. I realized that we had to really cut our own way and cut to the bone, so we had the moral argument to go to the federal government and say, help us. That's where we are. So his initial plan is a joke. I don't appreciate it. I think they need to recognize, like other people in his own conference are recognizing, local and state governments need help, or else you're not going to help the unemployment rate if you don't give us help. So I just, enough.
As a loyal Republican, did you ever imagine the day you'd be critical of the Republican majority leader, but needing help from the Senate minority leader who's a Democrat?
Yeah, I've been pretty bipartisan over the years, and I will speak to truth and truth to power. In this process I haven't really second-guessed those executives at the higher levels. I've given them the benefit of the doubt with intention, because I understand what they're going through. But this is just ridiculous at this point. This isn't a time where you pick and choose where you want to help out related to the 100-year pandemic. We need help. You told us to shut down. We did. Help us. Unfunded mandate. Republicans don't believe in unfunded mandates. Leader McConnell knows this.
Ryan, can you repeat, you said of the 66 confirmed new cases since last Thursday, what percentage were ages 15 to 29?
39%.
39%. And when we look at that chart, can we take literally that one case caused 18 other cases?
This is a cluster. The specific events are not accurate, but this is an accurate portrayal of something that has happened.
So does each one of those circles represent more than one case?
Represents a case.
A case.
Yep.
So is that an actual case study, or is it?
Correct.
Okay. And what time frame did that happen, from the graduation party to when all other 18 people got sick?
So for every cluster, every period of time, it really takes about 2 weeks, a little over 2 weeks, before you really can showcase the full effect of something that happens. And so the good news is that we could probably put up 4 or 5 of these over the last 3-4 weeks, and we could probably show how 1 or 2 or 3 or 4 things that happened drove more than half our cases for that period of time. That's the good news. We know where it came. The bad news is we're still very vulnerable for this to happen again. So that's why we know it can happen. We show these visuals so that people can see what we see, and hopefully make the right decisions when they're put in a position where maybe they can make a mistake.
When you look at something like that, how important is it to get test results back quicker versus now, where I know I just spoke with someone who her quarantine has expired and still doesn't have a test result? Yeah,
so if you want the data to come back as quick as possible, because that's the best for contact tracing. If in that case, I'm not sure the case, but she said if her quarantine expired and then wasn't symptomatic at the end of the quarantine, chances are even if she had it, she would have done what the recovery process would be. But it's not an ideal situation that we're in right now as a country. You need to be able to get these test results back quickly, contact trace. There's always an element of whether or not someone's being 100% honest with you, or if they're missing something. So turn times are important. Citizens who do the right thing, if they're symptomatic, they stay in the quarantine like we ask them to. They're doing the right thing for their community, and that helps us. But right now, not ideal. We have a new lab that's coming on with the labs at the Syracuse Community Health Center this week. We've looked into and we'll be purchasing our own rapid testing equipment to help build on the infrastructure that's already existing in the community. Hopefully this can be used in ways to get portions of our economy open again. But these are all things that we do, and right now there's not much you can do except find new partners and plug them into areas to help turn this around from the 7, 8, 9 days to the 3 to 5 day period of time.
You had abandoned Quest when they caused delays initially in the pandemic, but now it seems that Quest is back involved with the health center and again causing the delays. When did they come back into the
Yeah,
picture?
they're not causing the delays. The outbreak in the country is. So very different circumstances. There's every lab, national lab, is inundated, and LabCorp, Quest, I mean, essentially they're the gold standard of labs. So this isn't anything that any one business did wrong. This is, you have widespread outbreak of the COVID virus throughout the country.
You said you're going to bring on rapid testing through the county. Can you elaborate a little bit more on that?
Yeah, we're going to purchase rapid testing machines, and that way we can beef up the rapid testing infrastructure in the community. We're very interested. I've suggested to the state multiple times for things like weddings and banquets where maybe there could be more than 100 people together. So hypothetically, remember the 1%, the rule of 100 people means one person has it. So how do you eliminate that risk? You test. So we're very interested in that and are willing to make those investments to get these segments of our economy open, and also in a situation like this to maybe alleviate some of the backlog. Symptomatic folks need to get faster turn times for us to do our contact tracing. Certainly that's a priority now.
What's the time frame for that? How fast can you get
Depends, Terry. Certainly if you have, if it's related to somebody that we believe is symptomatic and really needs to get a quick turn time, we can utilize some of the hospital infrastructure. Certainly the hospital infrastructure is being utilized for procedures right now, as well as patients that they have. But your universal testing, you guys see the stories now, you know, 7, 8, 9 days, 10 days in certain cases.
I apologize. I meant what's the timetable for the county purchasing the rapid
We'll have one of them in 2 to 3 weeks. Then we have to work out some things with a lab partner, but we'll have a rapid testing machine in 2 to 3 weeks.
How do you feel about the test results you've been getting back over the last couple weeks? They fluctuated a little bit. The averages have been around a dozen a day. But how confident can we be in that? Should we be a little worried that it's underreported because of the testing backlog?
I don't know. Maybe, to be honest. But I think what we saw is our 2-week cycle since the holiday. Remember, going into the holiday weekend, we had very good weather, people excited. And so I think that moment in time has been reflected over the last 2 weeks. So now we're really dealing with that week after the 4th of July right now, and what we're seeing now. And what we've seen the last few days is the data is stabilized. The community spread number today, 3. It's been a while since we had 3 in the community spread. So I like this new area where we are. Hopefully we can stay there. Really what we did a week ago and before then will determine where we are. And what people need to remember, and especially our young people, most of our young people like going to the gym, like getting a good workout in. We got to get these owners going, right? And you have public health officials that are advising leaders at all levels of government that are very concerned about gyms. And so they look at the infection rates. Let's make the case through our infection rates that we need to get these gyms open. I think we've made the case. I think we're there. But if we have spikes because everybody wants to go out and they don't want a physical distance, then we're going to have a problem. We're going to have a problem with reopening our economy. So we got to get these businesses up and off the ground. I think we're there. I think the time is now, but we need to keep that going and keep them open.
What's it going to take to get gyms open? You said you kind of had a conversation about that earlier today.
Yeah, I think we're getting there. I believe the state is trying to get there, but I say if not now, when? If you can't do it at 1, when can you do it?
What's the holdup? Ventilation systems or?
I think it's just we geographically, population-wise, we're so diverse as a state, and everybody's in a little different spot. I think the filtration systems, we went through that with malls. I think there's some pretty good, great company locally out of Pulaski that does this and doing very, very well. And so I think we're there. I think everybody's done as much diligence as they can do from opening up and opening up safely. So, and the infection rate's there. So we got to go. We have to go.
I wasn't with you on Thursday because I was covering the situation with the Fayetteville Manlius football team. I noticed a lot of the conversation on Thursday was about the contact tracing, but I'm wondering, you have not been shy of condoning bad behaviors from that podium, especially young people. Do you have the same criticism of football coaches who were doing something unauthorized by the district and not allowed in the state currently?
So if it wasn't allowed by the state guidance, they shouldn't have did it. That was a mistake. Here on Thursday, I wasn't as aware of what was the event. I was more concerned about, did you have a lot of young people around somebody who was positive, and were they all direct contacts? Meaning we got to do a lot of contact tracing and quarantining. We were very confident after I got briefed. Again, I don't know. We've had 3,169 positive cases. I could probably talk to you about background on 20 of them over this whole process. Nobody briefs me. There's HIPAA rules on things unless there's trends or there's gaps in the investigation. So my concern wasn't so much on that day as it was being reported by many of you, not what the behavior of the team was, what they were doing, when they were doing, but did we do a thorough investigation, and is everybody who had direct contact during that period of time in a quarantine? And that's where we were very comfortable. But if the coach was having a practice and they weren't allowed to practice via the restart guidelines, it shouldn't have happened. Glad to see the school district didn't condone it, and it wasn't sanctioned by the school district. That was good to see.
Ryan, do you have a similar case study or any knowledge that there's been a cluster or a spread because of a bar and restaurant in Onondaga County?
We have not seen any of that. We've been listening to the rhetoric in other parts of the state, so we were watching that very closely. There was one gap in an investigation related to a bar a couple weeks ago in Butternut Street. We have not, to my knowledge, had any cases from that when we put that out.
Syracuse University says it's going to hire students as contact tracers, 30 to 50. Your health department has very much led the way, managed the tracing in this county. Are you supportive, coordinating? What's your role in the contact tracing at SU?
Sure. So they work with our health department, and they are in addition to, not either or. So these are not, our health department has to do the contact tracing and for this community. So these folks will be plugged into our system as people that get the same training through Johns Hopkins, and then they will work with us, and I'm sure we will have a specific team really focused in on the college campuses, whether it's Syracuse University, Lemoyne, ESF.
Because when those campuses are full, that's thousands more people you'd be responsible for tracing.
It's a lot of young people. And so certainly we're encouraged by all of our conversations with various degrees of testing we're going to do with these young people when they come back. Many of them are going to get tested at home. Many of them will be in a quarantine and they get here. Even some of those who get tested at home and are quarantined will then test again. So we are going to be very, very confident that when all these young people come into town, we will find the hidden pockets of the virus, and there will be some. And then we will get those folks into proper isolation, and then hopefully we'll have a productive school year for these kids.
With summer camps, some summer camps and daycares, opening back up, is this an indicator of how schools will open back up?
Yeah, I think so. I think we're well positioned for schools. We had a call with the superintendents last week, getting from their perspective some of these guidance that they have to struggle through. They just saw a lot of it, so we're doing a follow-up call. There's certain things that they've been put under that makes their lives difficult, and so some common sense suggestions we have on how they can, the state can improve that. But I think with an infection rate around 1%, the buildings need to be open. If a parent is in a situation where they have the luxury of being able to be at home with their child and help their child distance learn, and that's their decision, they should be able to make that decision as well. But certainly with a 1% infection rate, and when we look at what we know about this virus, Remember in the beginning, we used to think the little ones were going to be carriers, and they were going to give it all to the adults. And that's what the concern was in the buildings. We can't have all these, lots of germs with kids. I got 3 of my own, right? That's not what the data has shown. The data has shown that when little people have gotten this, that they actually received it via household contacts, or a play date was scheduled and someone in that house had it, and the young person got it that way. Now it's different with your 16 and 17 and 18-year-olds, but your elementary age kids have not been carriers of this. So we know more now than we knew when we shut down schools in March. And certainly the infection rate now is at a very, very good point. So this is just part of living with the virus. We're going to do a lot of it. We've offered to try to implement testing for the staff, and we'll work with the districts so that we can try to be as uniform as possible within all the school districts so that it doesn't disrupt the economy, and we open schools up very safely.
What's the biggest concern with opening schools from that call that you had?
I think when you look at the regulations, the superintendents, there's just some language that a little bit different from state education compared to state health that they got to work through. Do you have enough physical space to do some of the classrooms in some of the bigger districts? Do you potentially have to, in some of the larger districts, do a day of distance learning and work that in or not, based off of the physical real estate? So these are all things that I learned about with them, and they're gonna get us a breakdown of things that could change that would help them do their jobs better, understanding that we want schools open, and we need to do it safely. And if parents want that option where they can keep their kids home, certainly that's an option parents need to have as well.
What business was fined twice?
I think there's a bar out, somewhere out on the water somewhere.
Can we get information on
You'll
that?
talk to our law department about that, Terry. I'm assuming you can because we find them, but
Yeah.
I don't want to be the guy to spill the beans and
All right.
get us in an Article 78. So talk to Bobby Durr about that. He'll share it with you.
You did not tweet what you ordered for lunch at Kitty Hoynes when you were there with Dr. Gupta. I'm curious.
It was excellent. It was a steak salad. Dr. Gupta got the veggie flatbread. She loved it, and she actually certainly wants to go back. So that was I think that was the second time Dr. Gupta went to a restaurant since the whole pandemic. So Ann went with me too. I forgot what Ann had. Ann was trying to get some of Dr. Gupta's veggie pizza. So, but it was a nice lunch.
The doctor's on a magazine cover. Did you see that?
I saw that. I think Ann's in that one too. So, yeah, very smart people I surround myself with.
Will you test out this new rapid testing system on yourself?
There's actually a new test coming out that we're looking at too to build up the infrastructure. I think I'm going to use that one, but so that no one can ask me this question again moving forward. For the public, to reminder, my daughter Madeline had a test. She had a procedure and she was negative, and my mother had another test recently. So everybody around me has been tested, but I will take the plunge and get tested very soon.
Is the new testing perhaps not nasal, and that's why you're willing to take it?
It's a different form of nasal. So there's various, as the technology expands in this pandemic, there's various forms of testing, and I will have no more excuses. But the nice thing is everybody can continue to wash your hands, hygiene well. I tease everybody. Remember in April of 2019, we had about 80 influenza A and B cases. Everybody did a great job with hygiene. April 2020, we had 0. So hopefully going into the flu season too, we'll have a very light flu season because we're all doing our part. Any other questions? Good news today overall on the data. This virus is still here. We got to be vigilant and diligent with it, but we're going in the right direction. And what we do today will drive outcomes for the next 2-3 weeks.